must constantly look at things in a different way.
The Healthcare Education Transformation Podcast was created by two physical therapists out of the desire to learn more about the different educational roles in physical therapy and healthcare, and how healthcare education works by talking with educational leaders and people with different perspectives within physical therapy and across interdisciplinary lines on how education can be improved to disrupt the status quo of healthcare education. This is our journey, and thanks for listening. Are you a third-year physical therapy student that excels on tests when you have study guides, checklists, and deadlines? With all of the information available about how to prepare for the NPTE, it's easy to get disorganized and not feel prepared going into the big day. NPTE Prep Success is an online course that provides PT students easy-to-use study guides and step-by-step guidance through the NPTE preparation. To learn more, visit kylericeprep.com. Thank you again all for your continued support, and now for the show.
Hi, everyone, and welcome to the Healthcare Education Transformation Podcast. I'm your host, Stephanie Wyrock, and I'm joined by my fellow co-host, F. Scott Field. And today we have the esteemed pleasure of welcoming Dr. Meredith Castin, the co-founders of newgradpt.com and the founder of the Non-Clinical PT. So what non-clinical PT is it was created to help physical therapists, occupational therapists, and speech therapists to transition out of patient care into a meaningful and effective manner. So thank you so much, Meredith, for joining. I have been a huge fan of your work for a really long time, and I still remember when we first connected through the Women in PT Summit. And I'm just super excited to have you on the show today. How are you?
Thank you. Yes, I'm excited to be here. Thank you so much for having me. Doing great. How are you guys doing?
Can't complain.
Yeah, we can't complain. You know, for our listeners who are listening and thinking non-clinical, like what happened with that, tell us a little bit about your early career and how you ended up where you are today, pursuing this passion of helping people develop these non-clinical careers.
Sure. So I started out as actually a web designer right out of college and did that for a couple of years. And then I hurt myself at the company party. And it was just like your classic dumb kind of just goofing off move. Got hurt, went to PT, and I was like, this is it. I can't believe I got better. I had a sore back for probably 4 months. And then finally my doctor sent me to PT, and all of a sudden it was like this miraculous recovery. 6 weeks later, I was completely fine. And so I was hooked and thought, this is it. I want to do this for the rest of my life and help people the way I was helped. And got out, basically everything fell into place at that point, because they were opening a PT school here in San Diego. It was St. Augustine, and they were doing scholarships. I was lucky enough to get a scholarship. So everything kind of fell into place, and I got in, went through school, was kind of overwhelmed by how much there was to learn, which I'm sure is a common experience for everyone. And then got out and realized it was just absolutely nothing like how I thought it would be. Even though I had done some shadowing, they require you to do the volunteer hours and work. And I was a tech in a number of places, but I think when I got out, the reality was just, I think the monotony of it was just very unexpected on my part. I think I was expecting it to just be much more, I don't know how to say it, but I guess just much more fulfilling in the sense of helping people more instead of kind of more monotony and more paperwork and spending day in, day out, sort of just doing the same treatments. So that's what ended up happening is I just kind of bounced around setting to setting and tried to figure out where I would fit in as far as just feeling that I had when I was a patient. And then I think it dawned on me about 3 years out where I was like, I think I like being a patient better than being the PT. And so I ended up thinking, okay, well, if I can put in 5 good years of clinical care, I can probably use this experience and maybe marry it with my previous web design career and do something like that. But I didn't know how, because the funny thing is you're out of web design for a few years and all your skills are obsolete. I guess it's a bit like leaving patient care for 5-10 years. You would probably say, oh, what do I really remember anymore? I have to kind of go back and learn it all again. So I tried to get some web design jobs. Nothing was really happening. And then that's when Brett approached me and said, hey, I'm thinking of starting this website, New Grad Physical Therapy. It's already been done for New Grad Optometry. Do you want to do it? And I said, sure, because I loved writing and didn't really know what else to do at that point, and was sort of shopping around for rehab liaison jobs and things like that. But not having a whole lot of luck at that point. And then right around when we started NGPT, it was like everything came together again. I landed a rehab liaison job and then was able to do some professional freelance writing, rehab liaison work, and launch NGPT at the same time. And then people were reaching out to me left and right when I was working at NGPT. And that's where the seeds of what I'm doing now were kind of formed, because I realized that so many people wanted help getting out of patient care. And I started coaching people just for free on the phone on my nights and weekends. And my husband started joking around and saying, "You're the patron saint of non-clinical PTs." But if anybody ever had a question, then Brett and Matt would send that person my way. And then when I ended up leaving NGPT, it just kind of kept going. So I set up the non-clinical PT, like really just to be a sort of website clearinghouse of all the articles I had written on the topic. And then it expanded from there because I had so many people reaching out at that point that I was thinking, okay, I have a full-time job and then I'm doing this on top of it. So I got to somehow figure out a way to find a balance. That's the really short version of it.
Yeah, so Meredith, with all that you've learned so far through consulting and your work with NGPT and with the non-clinical PT, do you feel overall that PT burnout is an issue that is becoming more of a problem, or is just kind of staying the same, or is it getting better?
I think that's a really good question, because I don't know that it's necessarily getting worse. It's definitely not getting better, but at least people are talking about it. So the way I look at it is, I think the issue's the same. It might be getting a little bit worse if you look at it from out. So I think there's that aspect of things. And so it's getting worse in that respect, but I think that it's staying the same in that it's not like you can't go much worse than 90% productivity. And so the big issues are debt and productivity and people feeling, well, we can get kind of deeper into the weeds of what burnout is, but when people start to feel burned out and you've got these two major factors and those are big complaints, they're not really changing so much except that debt is getting bigger. But again, people are talking about it. So I think just the fact that people are talking about it, they're writing about it, they're having these discussions, that's the important part, because now it's out there and it can't be ignored when it's so prevalent when in the discussions online.
I think that's a really important point. My husband is a physician and we've been having a lot of talks about burnout, mostly in the physician world, but I think that in healthcare in general, that is such a huge issue. How do you think that that's going to be solved, Meredith? Do you think that that is going to be like a top-down problem that needs to be solved, or do you think it's got to be a bottom-up approach, or what type of drastic things do we need to change in order to really solve this burnout crisis?
That's another great question, and I think if it were going to be top-down, we would already be seeing changes made. And it's not that we're not seeing people making attempts. I see a lot of hospital systems saying, okay, employees are burned out. We need to encourage them to take breaks. We need to encourage them to use these free 15-minute massages. And you see all these different perks that different large hospital systems are doing. So cakes for the anniversary of the hospital, that type of thing. But unfortunately, a lot of times clinicians, and with your husband being a physician, when you've got a clinician, a nurse, a doctor, a therapist, and they have to see X amount of patients per day and get their minutes and their units, they don't always have time to run over to the cafeteria and get a slice of that cake. And they definitely don't have a time to go and get the 15-minute massage that's being offered by the hospital system. So even though I see the efforts being made, I think that those efforts are mostly having an impact on the administrative staff, and the actual clinicians aren't typically benefiting from those. And so then you'll have them having required programs where you go through, okay, mindfulness training or all these different kind of surface fixes, where I really appreciate it. I appreciate when a hospital says, okay, we know that you're burned out. Let's have you all go through a mindfulness education course. But I think for us to really affect true change, it's going to have to be from the bottom up. And it's going to have to be through people taking a stand and saying things, just speaking up about it, saying, burnout is a problem. Productivity is not sustainable. This is corrupt. This is unethical. But then that leads into a lot of times people are drowning in such debt from school that they don't feel like they can speak up. And I think that's part of why I've been so vocal about it, because I'm no longer in the clinic. So what are they going to do? Fire me? I mean, I don't mind talking about it. I'll talk about it till the cows come home.
Yeah, Meredith, I've been a big proponent lately of screaming from the rooftops that, PT should probably just be the tip of our iceberg. I think there's a lot of opportunities out there if you're willing to take the leap and kind of think outside the box a little bit. But What are some of the options out there that exist aside from patient care that healthcare providers should be aware of?
Yeah, so I'm in complete agreement with you. I think that clinical care is just one of the many paths that we should be able to take. And you going through your educational doctorate, I don't know how much you've seen this, but at least with PhDs, they're encouraged to either go industry or go into education. So at least they have those two tracks. We typically have the clinical track, but then if you want to go into education, they might say, okay, go get your EDD. And if you want to go into research, go get your PhD, but you always have to kind of pursue extra education. So there are all these other tracks you can take that don't require additional education. You can go into, I'm going to start with the one that I did. That's writing. Obviously, it's one of the easiest ones. If you have a knack for it, it's super easy to kind of hang a shingle digitally and start writing. But other ones that people don't often know about are things like utilization reviewer. It's getting more common. People are talking about it more, but sometimes there's a little bit of a stigma about going toward that direction, because then you're seen as going onto the side of the insurance companies. But there is an approach of taking, okay, well, you're just trying to ensure that people are getting the care that they deserve, kind of not abusing the payers, basically. So I can see both perspectives. That's a popular one. Another great one is rehab liaison or clinical liaison. So you can work at a rehab facility, you can work for an assisted living facility, a SNF, and you're basically the marketing liaison. So you're trying to get referrals into the facility, and then you also will evaluate patients when they're leaving, when they're discharging, and say, okay, are they appropriate for this particular facility? Another great one is for you, for example, being that you've got your EDD, you could go into a clinical educator role, which is essentially teaching someone how to use either a technology or a tool. So someone like Bioness, they use people called clinical specialists, which is another term for clinical educator. And they have people who go out and teach people how to use the Bioness tools. And so you'll find that all the time. I know a new grad PT who went to a company called Leaf, and she's a clinical educator for them. And so that's one of the ones that's kind of less well known. But then there are also directions you can go where it kind of depends on whether you're okay with saying, okay, well, I could have done this without my background, because some of the ones I just listed, you really need that clinical background and even a license in order to do those jobs. But then there are jobs that you could do that don't require the license. And that would be something like recruiting. And again, even healthcare content writing, you don't need a clinical license to do it. And there are a whole bunch of other ones, sales, things like that, DME sales, account manager. So the sky is really the limit. And it's just a question of kind of identifying, if you do want to leave clinical care, you're wanting to try something else, what do you want to do? And then finding your way there, because it's not like we have established paths yet. I'm trying to change that, but it's not like nursing where they say, okay, well, here's a track for you to go nurse educator, and here's a track for you to go nurse supervisor. And we don't really have those established tracks. We just have to kind of find our own way.
I love that you have taken, your writing that you've done. I've read a lot of your writing and I love it. If you haven't checked out Meredith's writing, you guys, please do. It's very insightful. And I know that one of the things that I had been interested in last year was trying to branch out and do more writing. And kind of the stuff that you had posted on the Women in PT Summit group really inspired me to go after that dream. So, that's something that I think is really cool about what you do. But, the other thing is, like, there's this stigma attached to leaving clinical care.
Yes.
And I know that we've had these conversations before, but tell me a little bit about why you think that stigma is attached, what your thoughts are on it, and how we can eliminate that stigma.
The idea of the stigma, when people have, in my opinion, when somebody kind of says something negative about what you've chosen to do with your career, it typically reflects back on them and what they've been thinking with their own lives. So if they've chosen to devote their life to being a really, really awesome clinician, which is pretty much what we're told we need to do as physical therapists, is devote your life to being the best clinician out there. And then you come out and you say, I don't think I want to do that. I think I want to do something completely different and maybe grow and challenge myself in a way that has nothing to do with direct patient care. I think it threatens a bit of what they identify as. And so it's just like anything else. If you choose not to have kids, or if you choose to have kids and all your friends don't have kids, then whatever you choose to do with your life, it's a challenge to what the person's identified as sort of their life construct, I guess. And so my feelings on changing the stigma, I'm really passionate about it, because when I left patient care, I felt super embarrassed because, again, it was a second career for me. And when it didn't work out and I wasn't feeling happy and satisfied, I had people saying, you must just not like to work. You must be really lazy. You have no work ethic, some really mean stuff. And they would say it in jest. And I would laugh it off and everything, but it's rude. And I would have, I have people coming in the same way saying the same thing when I'm coaching them, working with them. And they'll say, my father said, I'll only support you if you go to PT school. And now that I'm, finding that I don't want to be a PT, he's really disappointed in me and saying it's a waste. So you hear all sorts of sides of this. And one of the reasons that I started the website and focused so heavily on the spotlights is that I want people who have really left patient care and completely gone on with their degree and done something really non-clinical and really innovative to get their time in the sun and to feel like they're still a really good PT who's worthy of the profession being proud of them, instead of feeling like they have to kind of scurry away with their tail between their legs. And I know that was kind of a long-winded way of describing it, but that's the whole reason I have the Spotlight series. And I definitely, by the way, I would love to feature both of you guys because I know you both have some non-clinical pursuits. So I'm finally getting on top of that, and I have more of a process for doing them. So if you guys ever want to be featured, I'd love to.
Oh yeah, that would be wonderful.
Absolutely, Meredith. And I think you brought up some really good points. I think jealousy becomes an issue. I think maybe deep down inside they want to get out of clinical and they just don't know how to do it. And at the end of the day, you as an individual and as a personality and your reputation and your brand as it grows, you're going to have haters, right? You're going to have people who just aren't a fan of you, and that's okay. Oh, yeah. You're also going to have a crew of people that are a fan of you, right? And so that's who you cater to. You help the people that want to be helped and that want to come to you. And, you can't really help the others until they decide to come around, if at all. So, it is what it is,
That's so true. And I think that's a really good point, because I think the first few times I got some real haters online, I would have some people saying some really mean things that I wasn't prepared for. And I've had people say, oh, you're just exploiting people feeling burned out. And I'm thinking, oh my gosh, that's the opposite of what I'm trying to do. I'm trying to just give people hope and give people a new chance if they feel like they made the wrong career move, or maybe they made the right move, but they got injured. But I think that a lot of times people just say things and it's out of fear or envy, or just more than anything, just a feeling of being stagnant where they feel like I can't get out. I'm stuck here. And that's where, that's where I feel really sorry, because I know that they could get out if they really wanted to, or they could just fix their situation. They might not have to leave patient care. They might just need to fix things. But it is saddening when they start spewing all this hate. And I just want to be like, there's so much else you could do without just being hateful. So.
Right. And, there are a lot of, as physical therapists or healthcare providers, not only are we advocates for our patients, but we need to be advocates for proper healthcare. And,
yes.
If you have a non-clinical job, you may be dealing with a bigger picture than just, say, some individual's life. So, that leads into maybe my next question. How are the non-clinical opportunities and pathways similar and different amongst other healthcare professionals, between PT and OT and speech?
Yeah. So basically, when it comes to PT and OT, they're actually quite similar. I would say the biggest area where there's a little bit of a divergence is with speech therapy. And PT and OT, typically, when I see a lot of job postings, so a perfect example would be skilled inpatient care coordinator or inpatient care coordinator. Care transitions toward coordinator is another one. They're all pretty similar, and they're in what I consider the case management family. So you have case managers, rehab liaisons, clinical liaisons. Sometimes clinical educator falls into that family, diabetes educator, things like that. And so PTs and OTs are generally considered for those roles, with, I would say, PTs having a slight edge over OTs. And especially if it's something like a liaison or kind of a sales rep, semi-clinical, semi-sales role that's following, say, a total joint replacement program, then you will get a lot of people that want a PT for that role, or at least a PT or an OT, not so much an SLP, mainly because they just haven't done the physical movements. And then I was thinking about it a lot before the show too, just thinking about all the different things that our different allied health, all of our rehab family can do. And one of the reasons that they don't seem to include SLPs in some of these roles also is that their shorthand and their terminology is a little bit different from ours. So a PT and an OT, we both use CGA, we both use Min A, Max A, Total A. And then speech language pathologists don't always use the same terminology. So I think from that perspective, that's why a lot of times they're not quite as favored for some of those roles. But I would like to see it change because they're just as capable of performing these roles, and they understand the challenges of discharge. That's why they want clinicians in these marketing roles where they're kind of semi-marketing, semi-case management. It's because they want someone with a clinical background in the role because we understand discharge and they want to eliminate those readmissions. So, and SLPs have every bit of understanding. It's just that I think it's a terminology thing if I had to make a guess.
Yeah, you bring up a lot of really good points there, Meredith. I think, at the end of the day, by using a clinician, it gives some credibility to the discharge planning. And like you said, having been through it. And I think, like you said, it's just a matter of coming around on the SLP. I think they'll get there at some point.
Mm-hmm.
But, one of the things that you kind of brought up that really kind of got me thinking was, I think it was Jimmy McKay that said basically when it comes to non-clinical stuff and like outside the box stuff, it's just connecting two dots, right? It's trying to connect your career and your education to whatever that outcome is that you're trying to figure out. So it's just how you leverage your background and your education. And that's how I've learned to use my clinical background and my educational doctorate in the non-clinical senses, is just leveraging it to whatever my outcome is, right? Whether it be online curriculum development and course development, or whether it be, educating the public about, fantasy football injuries, or, whatever it may be. It's just learning what you do well and leveraging it into a form, an output, a transfer of knowledge to some extent. And I think that really, if you just think a little bit outside the box and you take a little bit of time to pause, you can see that clear path and how to connect those two dots. So let's say that somebody is working in patient care and they're feeling burned out. They're starting to get to that point. What are some steps that they should do prior to considering leaving patient care altogether?
I think that is such a good question. And first of all, I just have to say the connecting the dots analogy is so brilliant because it's absolutely true. I mean, that's what I always say with people is the hardest part is identifying what you want to do. And then you just make a plan and then you know the steps to get there. It's not rocket science, but you have to find out what you want to do first. So if somebody's feeling burned out, I always say, first of all, try to figure out why you're feeling burned out. Do you actually enjoy the patient care, but you're in a situation where your productivity is unattainable? And so you feel like a failure because you say test as an achiever type. I'm a big fan of taking these two online personality tests, and they're free. One is 16personalities.com and the other one is called the Enneagram. And they will tell you so much about yourself. I don't think you should formulate your life around these tests, but they tell you so much about yourself and your critical needs as a human. So some people score achiever. In fact, I would say the vast majority of people I work with score achiever. I score a variety seeker. And so if you score as an achiever and you're working in a situation where you're not put in a position where you can achieve anything, you don't get accolades, you don't get recognition, you don't get raises, you don't get appreciated at the banquets, no one ever votes for a PT as best clinician of the year, then you're going to flag like nothing else in that job. You're going to hate it. And if you're a variety seeker and you're working in a situation where it's just mundane and you're seeing the same diagnoses every day and you're seeing the same type of patients, nobody ever changes. It's like you have the same lunch at the cafeteria every day, then you're going to get burned out. So I think just identifying what you want to do with yourself in your life is kind of the first step in identifying why am I burned out. Another kind of aside for this is Gallup, the polling company. They've done some really interesting research on what causes people to get burned out. And one of the things is not having a voice. And another one is not having a mentor. And another one is being put in a position where you're tasked to accomplish too much in too short of a time frame. So if you think about all of these things that they've identified, those are all pretty much endemic in the PT field, where pretty much all of us are scurrying around trying to get our units. Pretty much everybody is feeling like they can't necessarily grow. And all of these things that they've identified with Gallup are proving to be sort of issues in the PT field. So I would say identify which of those are the problem. Identify, is it a variety seeking thing? Is it an achievement thing? Do you need autonomy and you don't have it? And then once you've identified what you don't have in your current clinical role, see if there's either a setting or a patient population or maybe a company culture, a different hospital system where you can work and you can have that kind of you can have that kind of setup where you maybe don't have to stop treating patients. You have to change your hours in some cases. Some people, all it takes is feeling like, I just need to get to the gym every night. So maybe I need to go down to like 34 hours a week, and that's all it takes. And then some people say, oh my gosh, it's not the hours at all. It's just, I just don't like patient care. It's draining. It's emotionally draining. It's physically draining. But I think it's just so important to spend the time with yourself and identify what it is that you need. And then if it's something where you feel like it might be something you can switch or change in your job, then it's worth having a conversation with your manager. And I always encourage people, talk with your manager first, because in so many cases, people feel it reminds me of almost maybe coming out of the closet or something. I don't mean to trivialize what someone who's homosexual goes through when they come out of the closet, but it is a sense of coming out and saying, okay, I want to do something else. And I'm your employee. I'm your employee doing this one thing. I'm treating patients. That's supposed to be my calling, but I don't know if I want to do this. And so you feel like you have to kind of be vulnerable and tell your supervisor that. But so many of the supervisors, you have to remember, are in that role because they felt the same way. And if you have a good relationship, I wouldn't recommend this if you don't have a good relationship, but if you have a good relationship, in many cases, they'll sort of take you under their wing and say, well, here's some of the opportunities that maybe we can take from here.
My story is kind of a little bit like that. I'm in a weird position in that I'm somewhat stuck where my wife's a type 1 diabetic, stay-at-home mom. So we need some sort of medical coverage and benefits, right? So I need a 9-to-5 job to some extent. And, there were several times where I didn't feel supported by my employer, and I just didn't care. I said, all right, I'll do your job, the 9-to-5, then I'm going to go home and I'm going to grind and I'm going to do my own thing that I enjoy and that I feel is going to move the needle forward. And we don't ever have to meet, the trains will never meet. That's fine.
Yeah.
So I would never, worry about it. If you have ideas and you're not getting supported by your mentors and your bosses, maybe just start branching out and do a side hustle until it becomes a full hustle.
Absolutely. I think that everyone can benefit from a side hustle at some point. And it's just a question of your life situation, whether you can afford to make that side hustle your full-time gig. But I've known so many people who have gone the non-clinical route, and they've gotten there because of their side hustle. I have a friend who went into robotics, and she ended up the director of clinical operations at a robotics company because she started a robotics consulting blog, basically. It was a robotics blog, which grew into a robotics side hustle kind of consulting business that got her noticed by some robotics companies. And then she just was kind of discovered in a sense. And now she's doing clinical program manager at a large robotics company. And so you just never know where that side hustle is going to lead you. And definitely say that having that side gig, whether it's something you spend an hour a week on or 5 hours a week, or you just grind away like you do every night, I think it's something that can sort of re-energize your passion for your career in a way that you might end up discovering something completely new. I feel like right now in physical therapy, we're in this season where so many people are it's so prolific. So many people are coming up with all of these brilliant, it's such a bad time to be a PT in the clinical traditional sense, but it's such a good time if you're wanting to sort of shake things up and try something new.
I totally agree with all your what you're saying, Meredith. I think that, it's really important, and I tell this to a lot of young professionals, is to really find a company that has the same values as you. And that's one of the ways that I think is important in trying to prevent burnout. And then in addition, when you're doing your side hustle, like if you can find somebody that has those values, start your own side hustle that are your values, and then try to kind of grow it from there.
Absolutely. And values are huge. I'm glad you touched on that, because values are so big for, I think, most PTs. We went into this profession so that we could change and improve people's lives. And when we find ourselves working for companies that are all about the bottom line and treat us like interchangeable cogs in the machine, then it's really hard to feel like you're living up to the values that originally led you to therapy. And 100%, if you start a side hustle, I remember turning to my husband the night that I launched the non-clinical PT, and I said, I'm so sick of working for companies that are all about the bottom line and all they care about is just making a buck. And I will never, ever, ever, ever compromise my values with this website. So even if I make $0 ever on it, that's fine. And I've spoken with a number of people who have taken the same approach, and every single one of them has been successful for that reason, because they're not willing to compromise their values. They're not willing to compromise their integrity. And of course they want to be successful and they want to monetize it and they want to be able to focus on it and make it their main gig. But I think it's when you take the idea of this is something I want to do to improve the profession, or this is something I want to do because I enjoy working on it, or because I feel like it'll help other people. Those are the ones that spring up and really just kind of take off.
Yeah. So Meredith, tell us, how lucrative are non-clinical avenues for PTs, OTs, and speech therapists?
It completely depends, because there are some where you're not going to make a bunch of money, and then there's some where it will be very lucrative, and then there are the ones where it starts out maybe not as lucrative, and then your earning potential is much higher. So I will give you examples of all of them. So again, starting with the path that I took, writing, you start out making very little money. It's a lot of unpaid work at first. It's a lot of writing for exposure. And then pretty quickly what I found is you go from kind of not making a whole lot of money for being a writer, and then you just start being able to charge more, and then you become more in demand and people know your name, and it's kind of carving out a niche. You can make quite a bit of money, but I don't like to tell people, oh yeah, just go be a writer and within the year you'll be making your PT salary, because I'd be BSing them. But it is very, very possible. It just takes a couple years to get there. So that's one of those examples of initial pay cut, and then you can build back up to the PT salary. And then if you go for certain roles, another great example of that would be if you went for a recruiting role. You might start out as like a recruiting coordinator, where you're making a low base salary and you have some amount of commissions, but because you have no experience doing recruiting, you kind of have to start out low. But because of your industry connections, you'll quickly be very successful and you can make a lot. And in other cases, if you're smart, to use the connect the dots analogy again, you can connect the dots to a higher paying recruiting gig. Sometimes incidentally, there'll be a lower base salary, but then a higher payout for commissions. So you can be quite successful in a recruiting gig if you're able to land not an entry level kind of recruiting coordinator role, but instead more of a director of recruiting. And whenever people say, okay, I really want to do something where I don't have to go through the junior roles first, then that's a question of you have to get the experience while you're still a clinician. So help out with hiring at your clinic, help out with sourcing candidates at your hospital, make sure you're on the interview panel, just make sure that you're involved with anything involving recruiting if you want to go that direction. So that one can be quite lucrative. You can also start out not very lucrative. The ones that are almost always more lucrative to begin with would be clinical educator, sales, sometimes clinical liaison or rehab liaison. Because anytime that you have some sort of sales component, you're going to have that ability to make bonuses. And that's what attracts a lot of people to those roles. Is it's not that they don't enjoy patient care, and it's not that they don't enjoy being in the clinic, but there's not really an opportunity to sort of make, what can I say, performance-based incentives, unless you interpret performance as cramming in more patients. And then that comes back to compromising your values. And so a lot of these other roles you could definitely take, you can say, okay, well, if I'm getting more patients into this unit as a rehab liaison and I'm increasing our referral sources, that's better. That's getting more patients the inpatient rehab that they need. And it's actually you're doing a good thing by increasing your volume. And so I think a lot of therapists really thrive in those roles, because all of a sudden that achiever side of them comes out and they say, this is great. This is a way for me to get a reward for my performance without compromising my values. I'm thinking of other ones. So probably some of the most lucrative I've heard of are medical science liaison, but that one's tough to go straight from clinician. You usually have to go from either clinician to kind of a clinical educator role and then go into medical science liaison, or you're going to need some sort of bridge in there. And generally speaking, I've been told by medical science liaisons, it's not easy to go in via sales, which is what people assume you should do, is say, oh, okay, well, we start out in clinical care, then go into sales, then go into medical science liaison. It's actually apparently easier to go if you have that educational component or educational background. So again, with your EDD, that would be a really great way to leverage that degree, medical science liaison. And just to clarify what that is, because I don't think I explained what that one was, that's where you are sort of a middleman or a conduit of information between a pharmaceutical company or a biotech company or whatever the company is that you represent, and then subject matter experts. So in most cases, they're going to pick PharmDs or PhDs or physicians, someone who has that research-based doctorate. So I don't think that PharmDs do, but because it's pharmaceutical companies, they'll often let PharmDs do these roles. But they're going to want someone who has a deep understanding of clinical trials and things like that. But the times that they'll make exceptions for PTs will be someone who maybe has worked with a lot of MS patients. And then if it's doing clinical trials for an MS drug, then if you've worked in some sort of clinical educator role with a company that has anything with MS, then that's a good route in. That's probably not the best example, but if I spoke with one MSL, for example, who she worked as a clinician basically, and then she took the sales route, but she said that part was completely unnecessary in her journey. So then she went and worked for Bioness as a clinical specialist or clinical educator. And then from there, she went to a medical science liaison route.
Yeah, it sounds like a lot of different avenues out there non-clinically. Mm-hmm. And, my next question, Meredith, is what are some of the more uncommon or interesting avenues that you feel that rehab professionals may not even know about as far as non-clinical paths?
I would definitely say one of the more unique ones is MSL, because not many people realize that we can get there. They think that it's only for physicians or that it's only for PhDs. Another one would be medical writer, which is different from health writer. I consider myself a health writer or just a kind of a general content writer and editor. But a medical writer, you do need a bit of background. So again, I keep coming back to you with your EDD, but someone who has got a PhD or an EDD and who's done that doctoral level of study generally will qualify for a medical writer role because, and I'm not sure about EDD to be honest, but I know that PhD, if you've had to write abstracts and you've had to write a lot of scientific papers, then you're used to the type of writing that would be going into a medical writer role. So a lot of times people they start salivating. They see the medical writer's salary and they're, oh my gosh, this is so high. And I want to do this. And it says PharmDs can do it. And it says MDs can do it. And we're doctorates. Why can't we? But unfortunately, unless you've had some experience, whether it was through a PhD or through submitting proposals to CSM to present papers, unless you've got some experience with writing abstracts, they generally won't consider you. But you can take coursework. So this is something you can do if you really want to go the medical writing route, is you can take certain coursework to sort of get yourself up to speed. And we could put it in the show notes because I'm going to forget the exact lettering. It's something like CMPP. It's I something, 5 letters. And then it's like, I think it's CMPP. But I want to make sure before I tell everybody that. And, but you can definitely take a little bit of education or certifications to get yourself up to speed. But the woman that I spoke with about this said that the most important thing would be having either the PhD or just documented evidence that you can write this type of medical writing style where you understand rules and regulations and all the things that someone who's writing, I just write content about people's careers. I don't need to know those things. So there's no way I could land a medical writing role without additional training. So MSL, medical writer, those are both really unique. I would say telehealth, although it's not so unique right now because everybody's talking about it, but that one's very new, I consider it non-clinical, even though you're still a clinician, because one of the main reasons people leave the clinic is because of injuries. And so if you are injured, but you still really enjoy the patient education and you enjoy the patient interaction, it's a great route to go. There are lots of companies that are hiring, and then you can also hang your own shingle and work with someone to set up your own gig. So that one's interesting. Clinical educator, I think, is maybe not so unique, but it's one that we're not pursuing very often. And I would love to see people going more in the direction of clinical educator, because we're born to educate. We are the most educating people out there. If you think about all of the education that physical, occupational, and speech therapists do, that is what our job is. And yet these jobs typically go to nurses, and they don't always want to consider us. And so my feeling is, go for these jobs, tell them how education based we are, and change that. And then they'll start putting us in their job descriptions. But that's the whole grassroots effort, starting from the ground up.
What about consulting? How do you handle your consulting work with people that want to pursue a non-clinical career?
Yeah. So I started out actually doing hour-long coaching calls, which then became 90-minute coaching calls. And I really love working with people who want to get somewhere, but they're not sure where to start. And what those calls became was me going through, the more career paths I discovered, because that's pretty much what I do every day is I just go on the hunt and I find people doing cool things and then pick their brains and discover how they got there and help people discover how they can get there. And so that's what those calls started to become was, oh, I just heard about this new career and this career and this career. And I would have people take the personality test, and I have these custom assessments that I've created. And I was finding that we were blowing through a 90-minute call in a blink of an eye. And then we barely even touched the coaching part because it was just explaining everything that's out there. So that's why I ended up launching a course at the beginning of last month. And it's called Non-Clinical 101. And it's basically everything that I used to try to cram into a 90-minute call, which ended up being 6.5 hours of video. So I was like, oh, it's a good thing I didn't try to keep extending the calls out to cover everything, because it would have been 6.5 hours by the end. But that's what I do now when it comes to consulting individuals. I recommend that they take the course. It's a great place to start because it's a 4-step program where it starts out with identifying who you are, what you want out of life, your strengths, your skills. Some of it's taking those online personality tests I mentioned. Some of it is actually these customized assessments that I've come up with. And it's just identifying your experience and your skills, what you love to do, what you don't love to do. And then step 2 is saying, okay, well, here are the 14 most common paths out there, and great for analytical types who don't like to collaborate much, or this one's great for people who want to be on the road all the time and love collaborating and love meeting new people. And so that's step 2 is kind of taking what you learned in step 1, applying it. Step 3 is resumes, cover letters, finding the jobs. Where do you actually find these jobs? Because that's always tough. Where do you find them? A lot of times it's knowing how to search, knowing which terms to search, knowing which types of jobs you can find at which search engines, that type of thing. And then the final one is all about interviewing and negotiating and things like that. So that's where I start. But then if somebody still wants coaching, I offer the coaching to people who've taken the course just on a limited basis, where I love coaching people, but I lose my voice. You guys heard I like hack, like I'll cough, I'll lose my voice. That was one of the reasons I didn't want to stay in patient care, is that it was so much talking that me with my like wacky vocal cords that I've had my whole life, I would just lose my voice all the time. It was so frustrating, like 4 or 5 times a year, just from the stress of always being on. And so now I take these calls on a limited basis. If people are really interested, they want to be coached, they understand the lay of the land. It's kind of like I'll take a PT student who's gone through PT school, but I'm not going to take someone that I have to teach all the stuff that you learn in PT school. And so that's kind of my approach now with consulting people is, if you've taken the course, you know the lay of the land, let's talk. I would love to consult and coach. And then the other, I guess, type of consultation is that when I get in touch with companies, and every spotlight that I do, I try to make sure, I know I've spoken with you about this Scott, for a while. I try to highlight people who work in bigger companies to start out, because I want to get hiring decisions. I want to talk with them and say, you need to be considering PTs for these positions. And so that's kind of the other type of consulting. It's not a paid consulting, but I'm always trying to interject myself into these companies and say, you guys need to be hiring therapists. And so whenever I see a job description where I'm like, a therapist could do this, I'll try and write to the company and say, hey, have you ever thought about including therapists? And most of the time I don't get a great reaction. Stephanie, I was so excited about what you did with Aetna the other day on Twitter. You have like this great way on Twitter. You called them out. It was incredible. I don't have a big Twitter following. I've tried that in the past with like major hospital systems, and it's usually just crickets and tumbleweed. But I'm doing what I can. I'm trying to sort of change things from the ground up, and I keep bringing up the grassroots thing, but that's my way of consulting.
Oh yeah, that's what you have to do. I mean, you have to, the only way that you can change it is to be an advocate. And,
yes,
you know, I love listening to you speak about this, and I hope our audience can really hear the passion that you have for this topic. And it's like, I mean, it's incredible because we need to be included.
Definitely. And actually there is a special interest group that's in the process of being formed. And I know you're really active in the APTA. I have not been very active in the APTA. Part of it is that I'm not active in anything. I'm just like, I like to sit with my cats when I'm not at work. And I know it's a total crazy cat lady, but I've never really gotten active with the APTA. And again, it's like the voice thing. It's a lot of talking. I haven't really put myself out there. And so it's interesting. Rachel German from Talus Media, she is kind of spearheading this effort to get a non-clinical special interest group started. And of course I have to be like, what does that mean? What does that even involve? Because I'm not involved, so I don't know. But she's walking us through the whole thing. And we have a Facebook group that's all dedicated toward the planning. I might have seen your names pop up in it. I kind of forget whose names were.
I've joined that group.
Yes,
Yes,
we're in there. We're in there.
Yes. Oh my gosh. Well, I know you guys are super active in the APTA, so get as active as you want in there. Support it. I want to do everything I can to make it successful. Rachel said, so excited who wouldn't otherwise belong to the APTA. And that's where I feel like we have such an opportunity to get some more cohesion back. There are a lot of people who don't want to join the APTA because they feel so disconnected and they're not seeing the effects of what this organization is doing on a day-to-day basis. But I think if they can get involved in a special interest group where they say, I've always wanted to move into a startup, a tech startup, and work with robots, something like that. But now there's actually a path, and now there are actually sanctioned CEUs that we can take so that we can learn about these things. It's going to help people join the APTA, and it's going to reinvigorate the professional organization. I mean, I'm not so self-aggrandizing as to say, oh, it's going to save the APTA or anything like that. But I think it will get a bunch of people who wouldn't ordinarily join the organization and get them to come on board and get excited about being a PT again. That's what I really would love to see, is people feeling excited about their profession again.
Yeah, for sure. Well, Meredith, you've done a great job advocating for physical therapists and a great job educating people as to the non-clinical side of things. So thank you for your time and for coming on tonight. We like to ask every one of our guests this final question. If you could change one aspect of DPT education, what aspect would you change and how would you change it?
Oh, that's such a good question. So the one I would change is I would make it less expensive, because even though I know that's not going to move the needle as far as what I'm doing personally, I think just not having debt hanging over your head as a clinician will make more people want to stay in the clinic. And I don't want everybody to leave the clinic, then we have no PTs left. So that would be the first thing I would do. As far as how to change that, God only knows. I am not an expert as far as how to reduce the cost of education, other than just, I hope, advocating through the APTA and helping them understand just how much the debt is causing people not only to burn out, but to leave patient care because they're seeking a more lucrative profession. So there's that. And then if I wanted to get a little bit more, I guess, granular with things, I would say I would love, love, love to see more informatics in our educational system. Not just informatics, I should say, but that's the big one. I would love to see more courses taught, maybe as electives or having tracks in robotics, informatics, data analytics, education, instead of having to go and do what you did and go get this expensive second degree on top of everything else. It would be great if you could just have a focus or a track in school. So that would be wonderful. I also highly recommend that you guys chat with someone who he's non-clinical, but he's fascinating about the educational system. His name is Mike Yangling, and I can connect you guys with him. But he's got some really fascinating ideas that we were sort of shooting the breeze the other day about. And one of his great ideas, he said, wouldn't it be great if PT schools could team up with engineering departments and have a specialty where you could go into adaptive technology, robotics? I see your face. Is that something you've thought of? That's awesome.
No, we were just saying that there needs to be something like that, especially even like Stephanie was talking about many, many months ago about some sort of fast track to a terminal degree from the DPT or something, yes. Because that's a big issue we're running into. We're not going to have enough terminal degrees to supply all these new programs that are coming out, and we just need to be more innovative. We're pretty innovative on our day-to-day, and we just need to utilize that for other aspects of our field and our profession.
Definitely. I think in our profession, if we could definitely align ourselves with other professions that are innovative and are technology driven, and show them how we can work together. We're so user focused. User experience, we didn't even touch on that one. User experience, in my opinion, is a natural non-clinical career for therapists to pursue, because we are the definition of user focus. We live our entire lives, our entire careers is focusing on what the patient needs, what the user needs. And so when we go and move into these careers, it's unbelievable how how well we settle into them. I know a speech language pathologist who went into UX and she's just killing it. And I'm speaking with a PT this upcoming week who's she went and got a PhD and now she's working at a robotics company in UX. And why don't we work while we're still in school in these arenas? We should be the tech innovators. We should be driving change. I love that we treat patients. I love that there are people whose life's work and their calling is treating patients, and they want to do that till they're 75. That is incredible to me, and I envy it. I admire it. But that's not me, and I sense that's not any of us. So why isn't there a track for each of us to take? There should even be an established APTA track, political track, activism track. And there might be, because again, admittedly, I'm not super familiar with the workings of the APTA. I've been a member, but just kind of like a quiet member. But I just feel like we have to have track so that when people spend this much money on school, when they're spending, people are coming out with $200K between undergrad and PT school, there needs to be recourse. They need to have options if they get injured, if something happens. And there's some people have autoimmune situations and they can't treat patients because they're sick all the time. And one other thing I was going to say is I went to St. Augustine and they started a clinical nurse informatics program. And I was like, what the heck? It is a PT and an OT school. Why is your informatics program called nurse informatics? This is so messed up. And it makes me so mad. And I called someone, and I tried to get them to talk to me about it. And of course, they're just like, okay, whatever you say, Meredith. And I get that a lot, whatever you say, Meredith. But just the fact that that's happening, how is that okay?
I agree. I think that, this conversation, Meredith, has been super eye-opening. I hope that our audience has really gotten a lot from it, because we have had people reach out. People have reached out to us and have said that this is a topic that they're interested in. And the passion,
oh, nice.
The passion that you bring to it is very refreshing and just engaging. And, I'm sure that you're going to have a lot of people contact you after they listen to this podcast. So where can they contact you?
Thank you so much. My website is thenonclinicalpt.com, just all one word, thenonclinicalpt.com. And then if they want to see information about the course, that's just nonclinical101.com. Again, no dashes or spaces or anything. And please reach out. I mean, I love hearing from people. I spend a good chunk of my day every day just kind of answering questions and communicating. And if any of the listeners want to be featured, again, including you guys, or if anybody has a connection and they have a non-clinical role, I would love to chat, because that is exactly what I want to do, is just connect the right people. And again, if people want to get involved, that's another thing. Please join the non-clinical SIG. I can send you guys the link to the Facebook group, which you probably already have it. But anything you want for show notes, just let me know. And I can send you links to those personality tests that we mentioned too.
Yeah, awesome. We'll include all of that in the show notes. Thanks again, Meredith, so much for your time and for coming on.
Thank you guys so much for having me. It was a blast.
Access to healthcare is one of the largest issues facing both providers and patients, as millions of people worldwide lack timely and affordable access to healthcare. Anywhere Healthcare, a telehealth platform, is a simple, low-cost option for providers and patients that eliminates the barriers to access to all kinds of healthcare. To find out more, check out anywhere.healthcare, which is available in our show notes. And if you use the code HET in all caps when you email to sign up, you'll save 25% off the total cost. Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter at HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.